Hey, Namaste everybody. So as promised, this is a photograph of my latest x-ray on my right leg. The right leg is my ankle. So this is showing the metalwork, but it's showing something a bit more sinister. This is bone mutation from complex regional pain syndrome type 2. If you look on the left-hand side of the picture, where the metalwork is with the 6 screws, you'll see there should be a nice gap in between the 2 bones, the fib and the tib. Okay, so there should be a nice gap going all the way down here. If I go to the next picture, you'll be able to see better. If you look at the top of the picture, here, you see the gap in between these 2 bones right at the top. There should be a nice gap going all the way down this picture to separate these 2 bones. Now this is bone mutation through complex regional pain syndrome. CRPS mutates your body, it mutates your bones. It's basically your body attacking itself, it's autoimmune. Now if you look here, it's a real mess down this side, it's all mutated of course. If you look here, there should also be a nice gap in between the ankle joint. Okay, here it's bone on bone. And in between, that's calcium deposits. Okay, so whereas you see that little gap there, that tiny little bit where it's black, where it's unaffected, that's what colour this joint should be. So if you look at that colour there, that little gap, there should be a nice colour going all the way through this joint and also down here. And the whole thing, okay, here is how it should look all the way up. But there's no gap, right? It's bone on bone and calcium deposits. So this is mutation of the bones and osteoporosis. It's where the bones thin and they thin and they thin. The bones should look that colour, okay? It shouldn't be all shady like this and grainy. This osteoporosis or decalcification of the bones. Okay, so it looks like there's tiny little stress fractures all the way through, and there is. Indeed there is. These are stress fractures because the bones become so thin and so weak. So, yeah, there's not just one problem, there's many, many different problems. And CRPS is a highly complex disease. Of course, they did the best that they could to fix me. This was 14 and a half years ago. I had a trimalleolar fracture. I smashed my ankle to pieces. It was a pretty terrible accident. And what I didn't know back then was that from breaking my leg, from breaking my ankle, from that very day I had CRPS. And for 14 and a half years, I was wondering, well, for 12 and a half years until I got my diagnosis, I was wondering why I kept getting confused, kept losing my memory, kept the leg. I knew that I had extra strong pain. It was unthinkably stronger than the original fracture. But what was confusing me and what was confusing everybody else around me, including the doctors, was that for several months I'll be laid up with my foot turning blue, with the massive inflammation, and the bones were all mutating like this, and the doctors didn't know why. But then I'll be fine. In the early onset stage and in the acute stage, I will be fine. I'll be walking again, like without even any crutches. The inflammation would reduce, the swelling would reduce, the colouring would go back to normal, and I could walk again. But then it would happen again. A year or so later, it would happen again, and I'd be off my feet again. And all of my friends were wondering why I was making all these different excuses, why I couldn't come out, and why I wasn't going anywhere. And it wasn't because I was being lazy, it was because I was in so much pain. But the doctors kept telling me there was nothing wrong with me because they were going by my bloods. And to regular GPs, if your bloods are okay, then they say there's nothing wrong with you. Well, CRPS isn't picked up in the blood. It's picked up using the Budapest criteria. And as soon as I saw a doctor who knew about this, he immediately said, I know what it is. You meet the Budapest criteria. So that's how I got the diagnosis. So basically, the joint is, it's just bone on bone, and everything's mutated so much that the bones are fused together in a really terrible places. And on top of that, there is the stress fractures. Oh, the picture's gone now. So CRPS weakens your bones. It decalcifies or demineralizes your bones. It strips your bones of all of what they need to make your bones strong. So you get these tiny little stress fractures running all the way through the bones, like you saw on that picture. It looks like little lines going down. What I didn't realize that whenever I was going for walks, I used to love walking. I used to walk all over the place. Every time I was walking, every time I was putting my feet down with the vibration, it was giving me stress fractures, and I didn't know. But it would take months and months and months until the next flare, until I felt the pain of all of these fractures building up and building up, and then I'll get this massive CRPS flare. I'll be off my feet again for another few months. But then just a couple of months later, I'd be walking again. The swelling will go down. I just put it down to, I had a nasty break. It was a nasty dislocation. I just put it down to that. And I kept just getting on with it and managing as best that I could with painkillers and using crutches when I needed to use crutches. And then there was other months where I could just walk without any crutches. So this was confusing my doctors. This was confusing the surgeon. This was confusing the consultants. And it was confusing me. And it was confusing my friends. And a lot of my friends accused me of making it up. It was only when my foot started tripling in size and spreading up my leg and turning black and blue and purple in colour, and I was getting these white splodges all over the place, crazy things going on. And then the bone mutation, that's when they started saying, okay, there's something else going on here. And that's when they agreed to send me to a private ankle surgeon called Mr. Matt Welk in the Royal Orthopaedic Hospital in Marsden. He was the first guy to primarily diagnosed me with CRPS type 2 in the chronic stage. And then later on, Dr. Andreas Gobel, my CRPS consultant, confirmed everything that Matt Welk had mentioned in his report. In fact, Dr. Andreas Gobel went further and he said there's something else going on. It's not just CRPS. Sure enough, I got a diagnosis of functional neurological disorder. There was something else going on. There is something else going on. And it's called FND. It's another nerve disease. 2 nerve disease back to back. Double trouble. And then I got diagnosed with lymphangexia, which is a stomach disease. 3 diseases. So that's where I am. That's where I am today. And there's nothing anybody can do. None of these diseases can be cured or even treated by any surgery or any treatment or any medication. So they're just trying to manage the symptoms, which are pretty much impossible with CRPS and FND because the pain's too high. The only drug that works to reduce the pain is ketamine. The Americans have proven this in thousands of studies. But because the British don't know about this, in the UK they don't know about this, they haven't done the research yet. We're like 15 years behind the Americans, and we're a century behind the Italians. I've been told that there's pretty much no hope of anything helping me at this stage, but I still hold my hopes up because you have to. Okay, I hope this video helps. I promised I would send this video a long time ago, but I've had 3 or 4 really, really horrific days with CRPS and FND, and it's been unthinkable levels of pain 24/7. So it's only yesterday and today. Even yesterday I had a flare. Yesterday starting at 1 o'clock, going all the way through till about, time was it, about half, I don't know, half 3, 4 in the morning. But then I got some sleep. So yeah, lots of flares just lately, but you know, I'm staying positive against all the odds. I'm staying positive. One love. Stay strong. Anybody, I know there's one other person who's got CRPS who's subscribing to the channel, so you know, stay strong. Stay strong, my brother. You're stronger than you think. Okay, namaste.